Well, good afternoon, everyone. I want to thank you all for coming, and this is a really wonderful attendance, so I really appreciate your attendance here today. Before we start, I want to start in a good way, so I'm going to invite respected Tsawwassen First Nation elder Ruth Mary Adams, visionary of the Great Blue Heron Way project. Ruth is a knowledgeable keeper and advocate for her community, people, and land. She is an integral part of the Tsawwassen First Nations and sits on the Advisory Council. And so I'm going to ask Ruth to please come up and do her First Nations greeting. Thank you, Ruth.
Hello, everyone. It's my great honor to be here for this event. It is so important to us First Nations, Inuit and Métis. And you picked a good one to do this because I used to work in a Delta hospital for 30 years. Not as a nurse, but I did the clothing and the linen for the hospital. But also, being a First Nation, we've had troubles with the sharing of the funds and the sharing of the services. So we are Treaty Nation. So we've done a lot with our little nation, getting all of our services, which is really good because we worked hard to get where we are. So I'm happy to be doing this prayer for all of you today because it means a lot to us First Nation, Inuit and Métis to be able to get good service the same as everyone else. And the other one I will say today, standing in front of all of you, it kind of is about the racism. As you can see, I'm First Nation, and we're all people of color here today. So it is about the racism, and it is a picking and choosing over who gets the funding and who should we look after. So I just thought I'd let you know that I understand where you're all coming from because we're in that very same boat. So I will start with a prayer and I'll just do a song that will end and give a blessing to the prayers that I'm saying for all of us. And I'll do this is the first time anybody ever says this, so when they come up to welcome you to the traditional territory, I got a new one for all of you. We all acknowledge and recognize all the First Nation traditional territories that we all live on. Okay, the emphasis on that we all live on because you all live on our traditional territories, and we're happy to have you. But we do need the safe and sharing health care together, okay? So in the name of the Father, the Son, the Holy Spirit, amen. Dear Creator, on this beautiful day, on this beautiful land that we all live on and the waters, we ask you to please give us the blessing of us being able to have Surrey Hospital, because that's where we all come from, Delta and from Tsawwassen First Nation. We need more service and we need more doctors, nurses, but especially, dear Creator, we First Nations need a better health care and a better mental health care for all of our First Nation, Inuit and Métis with all the trauma that we've had to go through. But for all of the children and the racism they all have to go through when they go to school, we ask you to please let the government look at us and balance out the health care, balance out the traditional care, and the schooling too. So we ask that in your precious name, that you will look after us in this good way and give Canada and give BC a heart that is sharing and caring of all of its people. So I thank you, Creator, for this beautiful day, and thank you for this beautiful crowd that we are all trying to get help, because it's all about the sharing of the funds. the more people you have, we should all be getting more funds for it. And Tsawwassen First Nation is growing, and Surrey is our hospital on this side of the Fraser River. So please help our government share the funding and make it more fair to all of us. I thank you in the name of the Father, the Son, Holy Spirit. Amen. All my relations. And when I say that, I really mean that, because this is what I do. I do prayers, and I'm an elder and a knowledge keeper. So when I say all my relations, you are all my relations. From now on, if you see me, just yank them and say, "Hi, I remember you." and just let me know, because I am an elder. So I remember faces, but I don't remember names. So I'll finish with this prayer, so it'll make my prayers go well. And this song I sing is from Chief Dan George from Tsleil-Waututh, because he did so much work with the public, and so do I. So here it goes. Woe he lo, hey lo, hey, oh he lo, he lo, hey. That was a short version, because I know you have all these important speakers to come up. But thank you. You're a great audience. And I really send my love and prayers out to all of you.
Thank you so very much, Elder Adams. Ruth is a gift, and I want to thank her for her grace and for all First Nations grace as we learn to live together on these lands. I first want to acknowledge each and every one of you for coming out today. I want to thank you for doing that. It's important. This is an important topic for us here in Surrey, but for all of us in the South Fraser, and as Elder Ruth just spoke about, for people in Delta and Langley and White Rock, Surrey Memorial is a pivotal hospital. The sheer number of healthcare professionals and members of the public who have turned out to collectively voice their concern speaks volumes on just how dire the situation is in Surrey, and to be fair, this entire South Fraser. I want to take this moment to thank everyone in healthcare in Surrey, especially those doctors, nurses, and other healthcare professionals that have been working in very difficult conditions to serve our citizens and our city. As one of the fastest growing cities in the province, and soon to be the largest in the Lower Mainland, Surrey, and the South Fraser for that matter, has been severely shortchanged when it comes to infrastructure funding, but so very importantly today, to provincial healthcare funding. It is about equity. It is about equity in Surrey, not only in comparison with other healthcare authorities, but in comparison to our own region. We We are simply not getting enough equity funding in the from the Fraser Health Authority in the fastest growing area in British Columbia. Growth in Surrey and the South Fraser has been exponential, and healthcare has simply not kept up. But to be fair, this is not and should not be a blame game on any one government. It has been systemic, and we have had decades of neglect of all of the key infrastructure in our region, and most certainly healthcare. I didn't know I was going to compete with the SkyTrain, but that's okay. And yes, there has been some additions, but not enough, not nearly enough. Surrey's population has doubled in the last 25 years, and it is on track to double again. When doctors, nurses, and other healthcare providers at Surrey Memorial sound the alarm bell, all levels of government must pay attention and must take action. It's time that all levels of government take action to ensure that the social infrastructure is in place to support our citizens and our future citizens. I have personally taken an extensive tour of SMH, and I have seen firsthand the concern and the frustration and actually the pain of our healthcare providers. They simply cannot provide the services that they can, and our citizens deserve much, much more, and we need better infrastructure. We all understand the need for housing in our region. Did you know that a classroom of children is born every working day at Surrey Memorial Hospital? And that growth will continue to be south of the Fraser, and we must ensure that services are in place to support those future citizens. The reality is that a new hospital and a new tower at SMH will not be enough to support our growth. But we need to rethink not only what the services are, but where the services are, especially those services delivered by the Provincial Health Authority. We have to ask why there is not a PHA hospital with a children's focus that is located here, where the children are, and why is someone suffering from a stroke, a heart attack, or trauma having to go over a bridge to be served. And to all of you who have come out to support our healthcare professionals and demand a more equitable healthcare system for Surrey, you are sending an important message to government. Our healthcare providers deserve our thanks and your support, and I hope that the people are in place that the people that are in places of influence and are here today are listening and take the messages from our speakers to heart, many of them with lived experience. While there are significant challenges, there is also opportunities, and you have my commitment to work with you to serve the residents of this growing city and this region. Thank you.
There's a little difference between the height. Let's do that. Sound good? Perfect. Thanks. All right. Hi, everyone. Thank you for coming. Honestly, this means a lot to us as healthcare providers. We look out. You are our patients, you're our friends and our family, and we applaud you that you are here today to stand up for healthcare for us. But we're here because collectively we're fed up with the neglect this region has experienced for decades. The chronic systemic underfunding and underinvestment has put us back so far and that neglect has real life consequences. This is a non-political rally. We as physicians are all frustrated within healthcare when it becomes political. The finger pointing gets us nowhere. We have come together as a grassroots movement led by physicians but backed by the community for the community. We have done this without any institutional support or funding. The support we did receive was from you, the people in the crowd. The media pushed the message for sure, but you are the movement. You are the message, and that is why it's important that you needed to be here today. Prior to your voice, there was zero acknowledgement that this region was neglected. Earlier this year, there was no plan, not at all, to bring a cath lab to Surrey, or that changes needed to be made. Promises made on June 7th were direct result of public pressure and you. Actually, people in our own department, senior physicians, were skeptical of our efforts of exposing the inaction of government. Because for years, they tried to rally the government to get the life-saving interventions here. Decades ago, people in my department knew there was a disparity, that there was no equity when it was compared to the north of the Fraser. But their outcries fell on deaf ears, and it's not because of the lack of effort on their part. It's because of neglect from the government. The message we are sending the government today is, wake up, pay attention, we're going nowhere, and we'll hold you accountable. For decades, annually, we receive hundreds of millions of dollars less than Vancouver. Yet our population has grown exponentially, and our people are sicker. We have the highest incidence of heart attacks, strokes, and kidney failure due to high blood pressure, diabetes, and our genetics. Yet we do not have those life-saving treatments south of the Fraser, and I'm not just talking about Surrey. We throw around words like equity, funding gaps, equality, but those words have real life consequences. Today, you'll hear real life stories from patients and their families of what this inaction by government has done to them and to their loved ones, and what these words mean to them. South of the Fraser cannot be neglected any longer. We need funding to follow the population growth. We need the bed capacity to take care of our sickest. We need to be able to treat the three leading causes of death with heart attack, stroke, and trauma without delay. Delay impacts outcome. I would like to introduce to you Nav Jassal, the widow of Dr. Jassal, who unfortunately had a heart attack at the age of 42 at Surrey Memorial Hospital. He left behind 3 young children because we didn't have the intervention there. She's here to share her experience. Thank you.
Thank you to Dr. Gill and all the physicians and all organizers behind this rally for making it a reality and for raising awareness of these important issues. Change is needed now more than ever. The stories that you will hear today will demonstrate just how dire the situation in South Fraser is. Stories that show the real life impact on decisions that governments have made and the reactive approach to healthcare. My story is one of them. I was asked to share my personal experience about the lack of healthcare services in Fraser South and the real life impacts they leave. In March of 2021, my husband, Dr. Andy Singh Jassal, a respected family physician in Surrey, passed away of a heart attack caused by a blocked artery in his heart while he was awaiting transport to Royal Columbian Hospital from Surrey Memorial Hospital to have that clot removed. Why was he awaiting transport, you may ask? He was already at one of the largest tertiary hospitals south of the Fraser. Why did they need to move him from Surrey Memorial to another hospital? Because while suffering from a cardiac event, an emergency that requires immediate attention and treatment, He had to wait to be picked up by an ambulance, cross a bridge, and travel to Royal Columbian Hospital to access their cardiac catheterization lab, because Surrey Memorial did not have one. The equipment that he needed was not there for him immediately when he needed it. Potential life-saving treatment was not there for him when he needed it. Instead, he was forced to await transfer to another facility across the Fraser River to access potentially life-saving care he required. Although we cannot predict the outcome of what could have happened if a cardiac catheterization lab had been available immediately to my husband, what we can say with certainty is that he was not given the equal opportunity for equal treatment because he lived south of the Fraser River. A few months ago, the NDP government announced a promise of not one, but 2 cardiac catheterization labs at Surrey Memorial Hospital, a direct result of the media attention and outcry from physicians and healthcare workers and the citizens of Surrey, citing a timeframe of 18 months. While this is encouraging to hear, I urge government to keep their promise and bring to fruition these cardiac catheterization labs that are so desperately needed in Fraser South, specifically at Surrey Memorial Hospital. We will keep advocating for these labs until we see the government follow through with their commitment. Actions speak louder than words. Stories like my husband's are far too common. I bet each one of you knows at least one individual who has suffered a cardiac-related event that has had to travel to either Royal Columbian Hospital, St. Paul's Hospital, or Vancouver General Hospital for treatment. Fraser South has continually been forgotten and sidelined by governments. As a community, we must come together to ask government, if not now, then when? This is not a question of should we. It's a question of why have we waited this long? I don't wish the tragedy that fell on my family and I to be endured by anyone. My hope is that by bringing further awareness to the disproportionate services between Fraser North and South that is so clearly evident in my husband's case, that government will start extending their ears and start actively listening to the community of Fraser South, start becoming proactive when collecting and assessing data related to health indicators and their prevalence in our communities of Fraser South, and start allocating appropriate funds so that equitable and accessible health care is available to every resident south of the Fraser. We deserve it. Thank you for taking the time to join our movement. Thank you for taking the time to attend today. There's power in numbers. Let's continue to advocate and make our voices heard. Thank you.
Thank you, Nav. That's always very disheartening, but we wanted Dr. Andy Jassal's voice to be heard, even though he's not here with us today. Many families endure bad outcomes, and also particularly with stroke and heart attack that we can't take care of. We transfer a minimum of 1,400 patients that are critically ill to other hospitals because we do not have the life-saving interventions. I don't want to take up too much more of your time. Everyone else will be talking about. I'm going to introduce Dr. Dosanjh. She's the past president of Doctors of BC, a family physician and a hospitalist. She has strong passion for social justice and healthcare equity. She's a visionary leader and led the recent healthcare transformation of primary care and helped create the longitudinal payment model. Help me bring Rummi to the stage.
Thank you, and good afternoon, Sat Sri Akal. Before I begin today and address the crowd, I just want to acknowledge Nav Jassal. Dr. Andy Jassal was actually my clinic partner, and he took over the care of my patients when at a critical time in my life I was unable to care for my patients because I became a patient. So this really pushes on our heartstrings when not only you have a colleague that suffers devastating consequence of inability to act quickly and have the same resources as we find in other parts of the province. And again, the glaring inequity is why we're here today. But more importantly, I come to speak to you as not only representing Doctors of BC today, which is our physician organization, and proudly they are standing with us and rallying with our patients today. But more importantly, of what community coming together can change and what we will no longer tolerate. I think many of us have come together to realize that it's not okay that what our funding and allocations and resources are much less than somewhere else. I believe all British Columbians deserve the same access and equity for healthcare. Equity for healthcare, access and quality of healthcare should not depend on your postal code. While we're not here to point fingers and blame anyone, because we're in this collectively, and I do understand collective organization, I also agree with some of our speakers today and follow Dr. Gill's sentiment. There is fear and reluctance to speak the truth. Oftentimes people feel that they can't come forward and speak the truth, but I encourage all of you to speak up. Use your voice, because voice is what leads to action. As we've seen recently, as you'll hear from one of our other speakers today as well, we can organize and we can commit to change. We know our Ministry of Health, our health authorities are able to make changes for the willing and for our communities that need it. We do not want these inequities to continue. We understand that Surrey Memorial Hospital is the busiest emergency department in Canada and the second busiest in North America. Yet the resources are a quarter of what's being dealt elsewhere. So who loses? Our patients, our families, our communities. That's who loses. These beautiful kids in front of me today, among us, championing for change. This is what matters. Our generations, our societal impact, and our legacy that will continue. But what we allow is what will continue. So today, I join forces with all of my colleagues, my peers, nurses, allied healthcare professionals, but most importantly, the community. As you can tell, I'm a visible minority too. As many of you, we advocate as physicians in the front lines and work on behalf of our patients. And we know that only goes so far, because it's time that our voters, our public, our patients get their voices heard at the table. Sometimes they're aware of what they're not requiring or what they're not receiving. But what is really clear and abundant here is that people are advocating for change, and everyone deserves a fighting chance, the same chance, in the name of healthcare equity. So today I'm hoping that the rally and the outpouring of support from every one of you and each of one of you compels you not only to step forward for your community, but because of the glaring healthcare inequity that continues to divide this province. All British Columbians should have the same access and same care. It should not depend on where you live, and it certainly should not depend on the lack of services. I have much privilege to also introduce the next speaker, who I've known quite well as a peer and a friend and a colleague, and also knows that we can make some outstanding change when our voices are heard. I commit today here in front of all of you that this work will move forward. And together, I know that we can have change, and it's inevitable. Dr. Jennifer Mervyn was honored by the Canadian Association of Mental Health as one of the 150 Canadians making a difference in mental health. She's a registered psychologist actively seeking to decolonize psychological and therapeutic practices while offering counseling and mental health treatment. She has an extensive background in trauma and substance use and utilizes innovative, culturally informed therapeutic approaches in her work. Jennifer is Métis, mother of 3, and a strong advocate for the Indigenous community. She consults, teaches, and trains on trauma-informed practice and policy nationwide. It's a privilege for me to introduce Dr. Jennifer Mervyn.
OCM, thank you so much. It's my honor to be here today to advocate for equality, especially for our Indigenous people. I just want to start by acknowledging that racially segregated healthcare is a sad part of our Canadian history. We do not see the attention brought to the history of Indian hospitals in our healthcare system. But let me tell you, this legacy has left inadequate and substandard care and a multi-generational impact for our people in regards to our willingness to even access healthcare. I want to say that because of that history of colonization, our residential school history, that Indigenous people sadly face some of the worst healthcare outcomes in this country. We do see documents like Fraser Health's Our Way Forward as very well-intentioned, hope for progress, that we are going to do things differently, and that we will bring equitable healthcare for Indigenous people and deliver culturally competent and culturally safe care. And yet, who can do this with inadequate staffing and resources at a hospital that sees so many Indigenous people? In fact, this happens to be a community where we have some of the highest numbers of Indigenous youth with disproportionate rates of mental health issues and addictions issues that need that acute level of care. Without these resources, we cannot fulfill these intentions that we set out for. I have a practice and I see a variety of different Indigenous people from a variety of different diverse backgrounds. But one of my greatest honors is that I do get to work with Tsawwassen First Nation. I can tell you from my own personal and professional experiences in supporting this community, the young people, the parents, the families, and the elders there, that there has been so many challenges in accessing appropriate care for them. And when they do come into Surrey hospitals, sadly, they are often left to come back to community without communication of discharge plans or care plans or even the prescriptions that they left ER with. And this is not because that the staff are incompetent or unkind or uncaring. This is because we do not have enough staffing and resources in order to be delivering that culturally competent care, to bring those messages back to our families, to those parents, to the elders, and to ourselves as the health and social services staff that support that community. I know that we can do better. We know that as Indigenous people, we need trauma-informed healthcare. In fact, trauma-informed healthcare benefits all of us. Every one of us benefit from trauma-informed healthcare. But that is absolutely founded on the basis of relationships. And when we cannot engage in recruitment and retention strategies for excellent healthcare staff and providers, we can't build longitudinal relationships with healthcare staff. We can't do what we need to be able to help support people in accessing the right types of healthcare in a timely manner. We're coming up to our National Day of Truth and Reconciliation. We're days away from it, in fact. And you know, we're pretty tired of words without action. There is no reconciliation without action. It's time that we see some action. Thank you.
Good afternoon, everybody. Thank you all for coming out here today and supporting this very collaborative effort and serving a much higher purpose here. My name is Jesse Gill. I'm a practicing emergency physician here at Surrey Memorial Hospital. I think it's already been said a couple times. Thank you. I think it's been said a couple times already. We are the busiest emergency department in Canada. This is not a surprise because of Surrey's exponential growth in its population, making it the second largest city. But I'm staring at that sign. The future lives here. It's going to be the biggest city very soon. The unfortunate reality is that my healthcare colleagues and I every day experience worsening conditions working in the emergency department. Emergency department congestion and crowding is only getting worse, and it's probably the worst it's ever been. Our patients are suffering, languishing in hallways, losing any form of dignity while we're trying to provide the standard of care. Our reoccurring cries for help are either acknowledged or ignored but there's been no sustainable flow strategy that's been implemented yet. Surrey's exponential growth, combined with very high complexity and burden of disease in both our adult population and our pediatric population, calls for urgent solutions. Investment in healthcare resources and infrastructure has definitely not kept pace and is lagging behind every other city in Canada. The systemic bias leading to disproportionate allocation of resources in south of the Fraser is truly disheartening. How can we ignore the fact that in Surrey, per 1,000 patients, we have 1 acute care bed, but you go to Vancouver and you have 5 beds? Where is the equality there? What about the fact that Surrey has 634 beds, whereas Vancouver has 3,000 beds for acute care? We have the busiest maternity ward in the province. In 2 decades, we've increased this space by 4 beds. It's only going to get busier with the population. Our pediatric emergency department is seeing double the amount of patients that it was built for. We have 16 beds and no pediatric ICU. During peak times, especially coming up in the next couple months, we're probably going to see numbers equivalent or more than BC Children's. Again, it's only going to get busier. We need more funded beds of all types. We need acute care beds, we need pediatric beds, we need obstetrical beds, and very importantly, we need mental health beds and capacity. There's been no race-based data on overdoses and specifically relating to the Surrey population. It blows my mind why we still don't have that information. This isn't a new problem. We need an equitable, proactive health plan that matches our current and future demographic needs. Action and accountability. In order for collaboration to work, we need our community to come together and we need to hold the leaders accountable. Thank you. At this point in time, I'd like to introduce and honor some of our local community leaders here and advocates who are not directly related to patient care, but they're directly involved with the patients and the families during some of the most difficult times when they're struggling. In these uncertain times, many people turn to these leaders like the ones that you'll hear from today to help navigate the hardships and provide support. The next person I'm going to introduce is the head priest at Gurdwara Dukhnavaran Sahib in Surrey. He's the president of the Guru Nanak Food Bank, and he's a notable and prominent Surrey community advocate involved in fundraising and supporting many, many projects in Surrey. Please welcome to the stage Gyani Narinder Singh Ji.
ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ। ਮੇਰੀ ਡਿਊਟੀ ਲੱਗੀ ਆ ਪੰਜਾਬੀ ਦੇ ਵਿੱਚ। ਜਿਹੜੇ ਬਹੁਤ ਸਾਰੇ ਸਾਡੇ ਬਜ਼ੁਰਗ ਇੱਥੇ ਆਏ ਹੋਏ ਨੇ ਉਹਨਾਂ ਨੂੰ ਦੱਸ ਸਕੀਏ ਆਪਣੇ ਇੱਥੇ ਇਕੱਠੇ ਹੋਣ ਦਾ ਅੱਜ ਦਾ ਕਾਰਨ ਕੀ ਹੈ। ਜਿਸ ਤਰ੍ਹਾਂ ਤੁਸੀਂ ਸਾਰਿਆਂ ਨੇ ਹੁਣ ਤੱਕ ਸੁਣਿਆ, ਜੇਕਰ ਸਰੀ ਦੀ ਪਾਪੂਲੇਸ਼ਨ ਦੇਖੀ ਜਾਏ ਤੇ ਦੂਸਰੀ ਜਿੰਨੇ ਵੀ ਰੀਜਨ ਨੇ ਉਹਨਾਂ ਦੇ ਨਾਲੋਂ ਫਰੇਜ਼ਰ ਹੈਲਥ ਰੀਜਨ ਦੀ ਜਿਹੜੀ ਪਾਪੂਲੇਸ਼ਨ ਆ ਉਹ ਕਿਤੇ ਜ਼ਿਆਦਾ। ਪਰ ਜਿਹੜੇ ਸਰੀ ਮੈਮੋਰੀਅਲ ਹਸਪੀਟਲ ਦੇ ਵਿੱਚ ਬੈੱਡ ਨੇ ਉਹ 600 ਦੇ ਕਰੀਬ ਤੇ ਵੈਨਕੂਵਰ ਦੇ ਵਿੱਚ 3000। ਮੈਂ ਤੁਹਾਨੂੰ ਪੁੱਛਣਾ ਚਾਹੁੰਦਾ ਕੀ ਆਪਾਂ ਉਹਨਾਂ ਰੀਜਨ ਦੇ ਬਰਾਬਰ ਟੈਕਸ ਪੇ ਕਰਦੇ ਆ? ਕੀ ਆਪਾਂ ਇਸੇ ਬ੍ਰਿਟਿਸ਼ ਕੋਲੰਬੀਆ ਦੇ ਸਿਟੀਜ਼ਨ ਹਾਂ? ਜੇ ਆਪਾਂ ਇੱਥੇ ਦੇ ਸਿਟੀਜ਼ਨ ਆ ਉਹਨਾਂ ਜਿੰਨਾ ਟੈਕਸ ਵੀ ਪੇ ਕਰਦੇ ਆ ਤੇ ਫਿਰ ਸਾਡੇ ਲੋਕ ਸਾਡੇ ਮੈਂਬਰ ਘਰਾਂ ਦੇ ਹਾਲਵੇ ਦੇ ਵਿੱਚ ਪਏ ਉੱਥੇ ਬੈੱਡਾਂ ਤੇ ਮੈਡੀਕਲ ਦੀ ਕੇਅਰ ਤੋਂ ਬਿਨਾਂ ਕਿਉਂ ਮਰਦੇ ਆ? ਇਹ ਇੱਕ ਸਵਾਲ ਹੈ। ਮੈਂ ਧੰਨਵਾਦ ਕਰਨਾ ਚਾਹੁੰਦਾ ਇਹਨਾਂ ਡਾਕਟਰਸ ਦਾ ਜਿਨ੍ਹਾਂ ਨੇ ਸਾਡੇ ਅੱਖਾਂ ਦੇ ਜਿਹੜੇ ਪਰਦੇ ਸੀ ਉਹਨਾਂ ਨੂੰ ਖੋਲ੍ਹਿਆ। ਅੱਜ ਤੱਕ ਅਸੀਂ ਇਹੀ ਸੋਚਦੇ ਰਹੇ ਸੀ ਕਿ ਸਾਡੇ ਕੋਲ ਡਾਕਟਰ ਘੱਟ ਨੇ, ਨਰਸਾਂ ਘੱਟ ਆ, ਸਾਡੇ ਕੋਲ ਵੇਟਿੰਗ ਲਿਸਟ ਬਹੁਤ ਆ, 10-10 ਘੰਟੇ ਵੇਟ ਕਰਨੀ ਪੈਂਦੀ ਹੈ। ਪਰ ਸਾਨੂੰ ਇਸ ਗੱਲ ਦਾ ਪਤਾ ਹੀ ਨਹੀਂ ਸੀ कि जे किसी नूं हार्ट अटैक हो जाए ਉਹਨੂੰ ਕਿੰਨੇ ਮਿੰਟ ਦੇ ਵਿੱਚ ਇਲਾਜ ਮਿਲਣਾ ਚਾਹੀਦਾ, ਔਰ ਜੇ ਕਿਸੇ ਨੂੰ ਐਬਸਫੋਰਡ ਹਾਰਟ ਅਟੈਕ ਹੋਏ ਤੇ ਉਹਨੇ ਜਾਣਾ ਵੈਨਕੂਵਰ ਜਾਂ ਰਾਇਲ ਕੋਲੰਬੀਆ। ਜੇ ਅਸੀਂ ਸਾਰੇ ਹੀ ਬਰਾਬਰ ਦਾ ਟੈਕਸ ਪੇ ਕਰਦੇ ਆ ਤੇ ਸਾਨੂੰ ਫਿਰ ਇੰਨਾ ਚਿਰ ਹੋ ਗਿਆ, ਇੰਨੀ ਪਾਪੂਲੇਸ਼ਨ ਵੱਧ ਗਈ, ਮਰਨ ਲਈ ਕਿਉਂ ਛੱਡਿਆ ਗਿਆ? ਇਹ ਸਵਾਲ ਹੈ। ਅਜੇ ਰੈਲੀ ਅਨਾਉਂਸ ਹੋਈ ਆ, 2 ਕਾਰਡੀਅਕ ਸਰੀ ਮੈਮੋਰੀਅਲ ਹਸਪੀਟਲ ਦੇ ਵਿੱਚ ਅਨਾਉਂਸ ਹੋ ਗਏ। ਅੱਜ ਅਸੀਂ ਇਹ ਕਲੀਅਰ ਕਰਨਾ ਚਾਹੁੰਦੇ ਆ ਕਿ ਇਹ ਇਸ ਤਰੀਕੇ ਦੇ ਕਾਰਡੀਅਕ ਖੋਲ ਕੇ ਗੱਲ ਨਹੀਂ ਬਣਨੀ। ਹੁਣ ਟਾਈਮ ਉਹ ਆ ਜਦੋਂ ਸਾਨੂੰ ਫੁੱਲ ਪਲੇਜ ਹਸਪੀਟਲ ਚਾਹੀਦਾ, ਬਿੱਡਾਂ ਵਾਲਾ ਹਸਪੀਟਲ ਨਹੀਂ ਚਾਹੀਦਾ। ਕਿੰਨੇ ਚਿਰਾਂ ਤੋਂ ਅਸੀਂ ਸੁਣਦੇ ਆ ਰਹੇ ਹਾਂ। ਅਸੀਂ ਕਿਸੇ ਵੀ ਪੋਲੀਟੀਕਲ ਪਾਰਟੀ ਦੇ ਅਗੇਂਸਟ ਇਹ ਕੋਈ ਰੈਲੀ ਨਹੀਂ ਕਰ ਰਹੇ। ਪੋਲੀਟੀਕਲ ਪਾਰਟੀ ਕੋਈ ਵੀ ਹੋਏ, ਗਵਰਨਮੈਂਟ ਦੇ ਵਿੱਚ ਕੋਈ ਵੀ ਪਾਰਟੀ ਹੋ ਸਕਦੀ ਆ, ਪਰ ਜਿਹੜੀਆਂ ਗਵਰਨਮੈਂਟ ਨੇ ਉਹਨਾਂ ਦਾ ਫਰਜ਼ ਬਣਦਾ ਹੁੰਦਾ ਹੈ ਕਿ ਉਹ ਪਬਲਿਕ ਦੀ ਸੇਫਟੀ ਨੂੰ ਧਿਆਨ ਵਿੱਚ ਰੱਖਣ, ਤਾਂ ਕਰਕੇ ਉਹਨਾਂ ਨੂੰ ਬਣਾਇਆ ਜਾਂਦਾ ਹੈ। ਉਹਨਾਂ ਨੂੰ ਜਿਹੜੀ ਪੇ ਮਿਲਦੀ ਆ, ਉਹ ਜਿਹੜਾ ਅਸੀਂ ਟੈਕਸ ਪੇ ਕਰਦੇ ਉਹਦੇ ਵਿੱਚੋਂ ਹੀ ਮਿਲਦੀ ਆ, ਤੇ ਸਾਡੇ ਸਰਵੈਂਟ ਨੇ ਉਹ। ਤੇ ਜਦੋਂ ਸਾਡੇ ਬਾਰੇ ਨਹੀਂ ਸੋਚਿਆ ਜਾ ਰਿਹਾ ਤੇ ਫਿਰ ਆਹ ਇਕੱਠ ਕਰਨ ਦੀ ਸਾਨੂੰ ਲੋੜ ਪੈਂਦੀ ਹੈ। ਔਰ ਮੇਰੀ ਜਿਹੜੀ ਸੋਚ ਸੀ ਅੱਜ ਦਾ ਇਕੱਠ ਉਹ ਤੋਂ ਬਹੁਤ ਘੱਟ ਵਾ। ਹਰ ਵਾਰ ਆਪਾਂ ਇਹ ਗੱਲ ਕਹਿੰਦੇ ਆ, ਜਦੋਂ ਸਾਨੂੰ ਜਾਗਣ ਦੀ ਲੋੜ ਹੁੰਦੀ ਹੈ ਅਸੀਂ ਉਦੋਂ ਸੌਂ ਜਾਂਦੇ ਆ, ਤੇ ਜਦੋਂ ਸਾਨੂੰ ਫਿਰ ਲੋੜ ਨਹੀਂ ਹੁੰਦੀ, ਜਦੋਂ ਸਾਡੇ ਕੰਨ ਤੇ ਪੈਂਦੀ ਆ, ਉਦੋਂ ਅਸੀਂ ਜਾਗਦੇ ਆ। ਪਤਾ ਨਹੀਂ ਕਿੰਨੇ ਲੋਕ, ਕਿਉਂਕਿ ਆਪਾਂ ਕਮਿਊਨਿਟੀ ਵਿੱਚ ਵਿਚਰਦੇ ਆ, ਜਿਹੜੇ ਹੋਰ ਵੀ ਕਮਿਊਨਿਟੀ ਵਿੱਚ ਵਿਚਰਨ ਵਾਲੇ ਲੋਕ ਆ ਇੱਥੇ ਖੜੇ ਨੇ ਬਹੁਤ ਸਾਰੇ, ਉਹਨਾਂ ਦੇ ਨਾਲ ਅਕਸਰ ਇਹ ਗੱਲਾਂ ਹੁੰਦੀਆਂ ਨੇ। ਕਿੰਨੇ ਲੋਕ ਸਾਨੂੰ ਫੋਨ ਕਰਕੇ ਇਹ ਗੱਲ ਕਹਿੰਦੇ ਆ ਕਿ ਸਾਡਾ ਬਜ਼ੁਰਗ, ਸਾਡਾ ਘਰ ਦਾ ਮੈਂਬਰ ਐਮਰਜੈਂਸੀ ਦੇ ਵਿੱਚ ਬੈਠਾ ਤੜਫ ਰਿਹਾ, ਕੋਈ ਤੁਹਾਡੀ ਉੱਥੇ ਗੱਲਬਾਤ ਹੈ? ਕੋਈ ਉਹਨਾਂ ਦਾ ਬਾਂਹ ਫੜ ਸਕਦਾ? ਕੋਈ ਇਲਾਜ ਹੋ ਸਕਦਾ? ਇੱਕ ਦਿਨ ਰਾਤ ਨੂੰ 12 ਵਜੇ ਮੈਨੂੰ ਫੋਨ ਆਉਂਦਾ ਹੈ, ਵਿਗਿਆਨੀ ਜੀ ਸਾਡੀ ਮਦਰ ਤੜਫ ਰਹੀ ਹੈ ਐਮਰਜੈਂਸੀ ਦੇ ਵਿੱਚ, 12 ਘੰਟੇ ਹੋ ਗਏ ਬੈਠੀ ਨੂੰ, ਅਜੇ ਤੱਕ ਡਾਕਟਰ ਦੇਖ ਨਹੀਂ ਸਕਿਆ ਉਹਨਾਂ ਨੂੰ, ਤੇ ਉਹ ਪੇਨ ਦੇ ਨਾਲ ਤੜਫੀ ਜਾ ਰਹੀ ਹੈ, ਔਰ ਉਹਨਾਂ ਨੂੰ ਕੋਈ ਦੇਖ ਨਹੀਂ ਰਿਹਾ। ਜੇ ਤੁਹਾਡਾ ਕੋਈ ਉੱਥੇ ਲਿੰਕ ਹੈ ਤੇ ਸਾਨੂੰ ਦੱਸੋ। ਮੈਂ ਕਿਹਾ ਇਹ ਕੈਨੇਡਾ ਵਾ, ਇੰਡੀਆ ਨਹੀਂ, ਇੱਥੇ ਲਿੰਕ ਕੀ ਕਰੇਗਾ? ਉੱਥੇ ਜੋ ਸਿਸਟਮ ਹੀ ਇਹੋ ਜਿਹਾ ਹੋ ਗਿਆ ਕਿ ਸਾਨੂੰ ਇਹ ਦਿਨ ਦੇਖਣੇ ਪਏ ਨੇ। ਥਿੰਦ ਸਾਹਿਬ ਦੇ ਰੇਡੀਓ ਤੇ ਮੈਂ ਡਾਕਟਰ ਸਾਹਿਬ ਦਾ ਟਾਕ ਸ਼ੋ ਸੁਣ ਰਿਹਾ ਸੀ। ਜਦੋਂ ਡਾਕਟਰ ਇਹ ਗੱਲ ਕਵੇ ਕਿ ਸਾਡੇ ਸਾਹਮਣੇ ਅਸੀਂ ਅਜੇ ਵੀ ਨਾ ਜਾਗੀਏ, ਤੇ ਫਿਰ ਸਾਡਾ ਕਸੂਰ ਆ, ਕਿਸੇ ਹੋਰ ਦਾ ਨਹੀਂ। ਜੇ ਡਾਕਟਰ ਜਿਹੜਾ ਇਲਾਜ ਕਰਨ ਵਾਲਾ ਉਹ ਇਹ ਗੱਲ ਕਹਿ ਰਿਹਾ ਕਿ ਸਾਡੇ ਸਾਹਮਣੇ ਹਾਲਵੇ ਦੇ ਵਿੱਚ ਪਿਆ ਇੱਕ ਮਰੀਜ਼ ਮੈਡੀਕਲ ਕੇਅਰ ਤੋਂ ਬਿਨਾਂ ਮਰ ਗਿਆ, ਜਦੋਂ ਉਹ ਮਰਿਆ ਤੇ ਅਸੀਂ ਅੰਦਰ ਜਾ ਕੇ ਆਪਣੀਆਂ ਅੱਖਾਂ ਪੂੰਝ ਕੇ ਸਾਨੂੰ ਰੋਣਾ ਅੰਦਰ ਜਾ ਕੇ ਪਿਆ, ਕਿਉਂਕਿ ਸਾਹਮਣੇ ਰੋ ਨਹੀਂ ਸਕਦੇ, ਕਿਉਂਕਿ ਉਸ ਡਾਕਟਰ ਨੂੰ ਪਤਾ ਕਿ ਇਹ ਬੰਦਾ ਬਚ ਸਕਦਾ ਸੀ, ਪਰ ਇਹਨੂੰ ਮੈਡੀਕਲ ਕੇਅਰ ਨਹੀਂ ਮਿਲੀ, ਮੈਡੀਕਲ ਤੋਂ ਬਿਨਾਂ ਇਹ ਬੰਦਾ ਮਰ ਗਿਆ, ਤੇ ਉਹ ਆਪਣੇ ਆਪ ਨੂੰ ਵੀ ਗਿਲਟੀ ਫੀਲ ਕਰ ਰਿਹਾ ਤੇ ਅੰਦਰ ਜਾ ਕੇ ਰੋ ਵੀ ਰਿਹਾ, ਪਰ ਬਸ ਤੇ ਉਹਦੇ ਵੀ ਨਹੀਂ। ਕਿੰਨਾ ਚਿਰ ਆਪਾਂ ਚੁੱਪ ਰਹਿਣਾ? ਕਿੰਨਾ ਚਿਰ ਆਪਾਂ ਇਹ ਕੁਝ ਸਹਿਣਾ? ਇੱਕ ਦਿਨ ਸਾਨੂੰ ਇਹ ਖੜੇ ਹੋਣਾ ਪੈਣਾ। ਔਰ ਅੱਜ ਤੋਂ ਮੈਨੂੰ ਲੱਗਦਾ ਇੱਕ ਰੈਲੀ ਦੇ ਨਾਲ ਸਾਨੂੰ ਖਤਮ ਨਹੀਂ ਕਰ ਦੇਣੀ ਚਾਹੀਦੀ ਗੱਲ। ਇਹ ਜਿਹੜੇ ਡਾਕਟਰ ਨੇ, ਜਿਹੜਾ ਸਟਾਫ ਹੈ, ਇਹਨਾਂ ਨੇ ਇੱਕ ਸ਼ੁਰੂਆਤ ਕੀਤੀ ਹੈ। ਸਾਨੂੰ ਇਸ ਗੱਲ ਨੂੰ ਠੰਡਿਆਂ ਨਹੀਂ ਪੈਣ ਦੇਣਾ ਚਾਹੀਦਾ ਜਿੰਨਾ ਚਿਰ ਸਰੀ ਦੇ ਵਿੱਚ ਫੁੱਲ ਪਲੇਜ ਹਸਪੀਟਲ ਨਹੀਂ ਆਉਂਦਾ ਜਿਵੇਂ ਬਾਕੀ ਰੀਜਨ ਦੇ ਵਿੱਚ ਨੇ। ਉਹਨਾਂ ਚਿਰ ਜਦੋਂ ਸਾਡੇ ਕੋਲ ਵੋਟ ਮੰਗਣ ਆਉਣ, ਜਦੋਂ ਕਿਤੇ ਇਲੈਕਸ਼ਨ ਆਏ, ਸਾਨੂੰ ਇਹ ਮੁੱਦਾ ਫਸਟ ਪ੍ਰਾਇੋਰਟੀ ਤੇ ਰੱਖਣਾ ਚਾਹੀਦਾ। 2024 ਦੀਆਂ ਇਲੈਕਸ਼ਨਸ ਆਉਣ ਵਾਲੀਆਂ ਨੇ, ਤੇ ਜੇ ਐਤਕੀ ਵੀ ਆਪਾਂ ਨਾ ਜਾਗੇ, ਜੇ ਇਹਨਾਂ ਇਲੈਕਸ਼ਨਸ ਦੇ ਵਿੱਚ ਸਰੀ ਵਿੱਚ ਆਪਾਂ ਇਹ ਕੁਝ ਨਾ ਲਿਆ ਸਕੇ, ਤੇ ਫਿਰ 4 ਸਾਲ ਫਿਰ ਇਸੇ ਤਰ੍ਹਾਂ ਹੀ ਆਪਾਂ ਦੇਖੀ ਜਾਵਾਂਗੇ। ਅੱਜ ਹਾਲਵੇ ਦੇ ਵਿੱਚ ਮਰ ਗਿਆ, ਅੱਜ ਕਿਸੇ ਨੇ ਫਲੋਰ ਤੇ ਇੱਕ ਬੱਚੇ ਨੂੰ ਜਨਮ ਦੇ ਦਿੱਤਾ, ਕਿੰਨੇ ਆਪਾਂ ਕੇਸ ਸੁਣ ਚੁੱਕੇ ਆ। ਇਹ ਹੁਣ ਬਸ ਹੋ ਗਈ ਆ, ਹੁਣ ਇਹ ਤੋਂ ਅੱਗੇ ਨਹੀਂ, ਸਾਨੂੰ ਜਾਗਣਾ ਪੈਣਾ। ਔਰ ਸਾਡੀ ਇੱਕੋ ਹੀ ਡਿਮਾਂਡ ਹੋਣੀ ਚਾਹੀਦੀ ਆ ਕਿ ਇੱਥੇ ਸਾਨੂੰ ਉਹ ਬੈੱਡਾਂ ਵਾਲਾ ਹਸਪੀਟਲ ਨਹੀਂ ਚਾਹੀਦਾ ਜਿੱਥੇ 170 ਬੈੱਡ ਹੋਰ ਆਉਣੇ ਆ। सानू फुल प्लेज हॉस्पिटल चाहिए जिथे सारा इलाज होए। जे किसी नूं स्ट्रोक हुंदा डॉक्टर कहंदा भी इन्ने टाइम दे विच जे इहदे टीका लग जाए ना ये बंदे दा पासा मरनों बच सकदा है, पर उन्ने टाइम दे विच वो रॉयल कोलंबिया ਜਾਂ वैनकूवर किवें पहुंचेगा ये तुसीं अंदाजा लाउणा है। और अज तुसीं ये भी फिगर आउट करियो, मैं डॉक्टर साहबान नूं भी बेनती करदा कि सानूं ये फिगरां चाहीदियां ने कि जदों किसी नूं हार्ट अटैक हुंदा, किसी नूं स्ट्रोक हुंदा, कोस्टल दे विच किन्ने परसेंट ने जिहड़े सर्वाइव करदे ने ते फ्रेजर हैल्थ दे विच किन्ने परसेंट ने जिहड़े सर्वाइव करदे ने। जिमी आसमान दा फर्क है, क्योंकि टाइम सिर जदों इलाज नहीं मिलदा उन्होंने 2 दिन दे विच अपॉइंटमेंट की वेट ते सानू 5 दिन दे विच। क्यों? असी टैक्स पूरा नहीं पे करते, असी इत्थे दे सिटीजन नहीं। सानू अपनी सोच नूं उपर ले जाना पैना। इहदे नाल ही शुकराना नहीं करना चाहिए भी बहुत वधिया, ये सारा कुछ बहुत वधिया नहीं। सारिਆਂ ਦਾ जिन्ने तुसीं आए हो सारिਆਂ ਦਾ धन्नवाद। अपने नाल 5 10 ਨੂੰ होर जागृत करो ताकि आने वाले टाइम दे विच आपां इहनूं होर अगे वधा सकीए, कुछ ना कुछ आपां प्राप्त कर सकीए। वाहिगुरू जी का खालसा, वाहिगुरू जी की फतेह।
Thank you very much, Gyani Narinder Singh Ji. The next guest I'd like to introduce is the lead pastor from Grace Point Community Church. He's the co-chair of Peninsula Housing, Homeless to Housing Task Force, and a well-known community activist. He has a passion to see all citizens of Surrey flourish. Please welcome Pastor Rick Brar.
Well, thank you, Jesse, and thank you everyone for coming. And this is a very important issue. As Jesse mentioned, I'm the pastor at Grace Point Community Church, a multi-ethnic church down in South Surrey. There's hundreds of us that gather every Sunday morning to worship God and do life together. And as followers of the Jesus way, healthcare is very important in our worldview. And that's why I'm here today. As an example, our church serves about 120 people every Sunday evening with a community meal. There's people who come who have financial challenges, who can't afford groceries, the working poor, the lonely, those with mental health challenges, etc. And this dinner program continues to grow because of the needs. I also co-chair the Peninsula Homeless to Housing Task Force. As he mentioned, we're a community table of about 120 people in our database, everything from faith leaders like myself, people who work in the healthcare system, people who are in government, community-minded people, people who work in social services agencies, etc. I'm also involved in helping establish a food security table in the South Surrey White Rock area because of the growing food insecurity that is happening in our community. So I come to this event through the lens of a community member who serves and supports people from all backgrounds. The needs we are seeing are outgrowing the resources that are available. Organizations and groups are struggling to maintain these services, and we will continue to do so. I just heard this last week that we're estimating now around 70 to 80 unhoused people on the peninsula. We have no temporary or permanent extreme weather shelter as we're going into the winter season. This will further stretch our resources. If there is not change, we will continue to see more inequity and more inequality. We will see more mental health struggles, more food insecurity, and more housing challenges. Many people are moving to Surrey, as has been mentioned. They come with the expectation, the infrastructure and the resources are in place, but they are not. Without increased funding to Surrey, more people will fall through the cracks and become vulnerable. As a faith leader, I want to see all people flourish. I worry that on this current path, this will not happen. And so I look forward to working together with all people to see the necessary changes that are needed in our city.
Hi everyone, thanks for being here. My name is Amol Lail. I'm an emergency room physician who was born and raised in Fraser Health and now have the privilege of serving patients here in Surrey. Thank you. Every parent's worst nightmare is that something happens to their child. In Surrey, our pediatric emerge has 12 beds and is built to see 20,000 children a year, or on an average, 55 patients a day. Last winter, we were seeing up to 200 patients a day. During that period, there was a shortage of pediatric ICU beds in the province, with no ability or resources to keep and manage high acuity cases in Surrey. Those are our sickest children. And in addition, we saw delays and shortages of vital pediatric critical care transport teams to get those children where they needed to be to get the health care they needed. Speaking to the importance of giving our kids every possible fighting chance is my dear friend and colleague, Dr. Sangiv Vohara, who is an internist and geriatric specialty physician in our community. Please welcome him to the stage.
Thank you, Amol. I feel quite honored today to be speaking amongst all of you beautiful people, respectable mayor, and the sacred land of the First Nations. I think we have heard a great deal in regards to the disparity, the inequity of the healthcare that South of Fraser, all of our people are receiving. I'm a proud Canadian. I'm also an immigrant like many of you here, but it saddens me to understand that our privilege to serve, sometimes it appears, may be differentiated only to the privileged. Is it so? We don't know. I'm standing here asking not to be privileged, but praying that all of us people here are not underprivileged. I'd like to share with you a personal incident that happened in my family. My brother-in-law, who himself is a physician in California, was visiting us. This is from a decade ago. My nephew, who was then 11, apparently fell ill. It was this month only, September. I got a call from my brother-in-law in the middle of the night, indicating that he wasn't doing so well. As he was from out of country, out of state, he wanted to understand how best he could be attended to. And at that point in time, while I have been a resident and a physician with Surrey Hospital for almost 2 decades, and I'm honored to be working amongst my colleagues, and I sincerely respect the bravery, the dedication, the skill that our doctors have in Surrey. I was made to make that decision to instruct him to take him to the Children's Hospital immediately. My family went to the Children's Hospital. My nephew ended up having a cardiac arrest, but to the grace of the care and the doctors at the Children's Hospital, and after about 3 weeks of intensive care and the fighting chance that he had at the Children's Hospital, he made full recovery. He's back in California. He's a 6'1" youth who made valedictorian, grade 12, top of his class, and someone who was feared may have not made it through that night. And even if he did, he may have suffered some consequences for being in cardiac arrest for a prolonged period of time and the intensive care that he needed. This shows to us that, and it frightens me, that being a physician myself, I was able to make that determination. And maybe a little bit of my medical understanding, a lot of the care at the Children's Hospital, and a lot of grace from God. He made full recovery. But how many of the residents south of Surrey may have that opportunity or the understanding or the knowledge to make that decision in time? It should not be so. As I said, I'm a proud Canadian. But those privileges and those rights seem to waver, it seems. Just by a border, north, south of Fraser, you go 20 miles north, west. It's not fair. It seems wrong. So I hope that with everybody's efforts, with all of you great people gathered here, that we can move forward to have that equity and that fighting chance for each one of the citizens that are south of Fraser as well. Thank you.
Thank you, Dr. Brar. That was a moving speech. There's all of our critical ill children need to be transferred. That's it. We do not have the capacity to take care of the sickest kids. If they're intubated, they need to be moved out. This is very tough to talk to parents, and especially when we provide care across the cities. And it's tough on when young families have other kids that they take care of. So they have one in the hospital, living in Surrey, Delta, Chilliwack, but they all have to go to BC Children's Hospital. So that's why we're really promoting. We want to have a full-fledged hospital here at Surrey because our growth is here. Now, talking about growth, it's my distinct pleasure to introduce Dr. Bakhet. He's one of the most senior physicians at Surrey Memorial, and he's dedicated his life to OBGYN with relief efforts across the globe, providing care where care is absent. Almost feels like Surrey. He is the previous chair of OBGYN's department, and he is here to share his experience.
Good evening. I think many of you know me since I've been here in Surrey since 2008. So I must have delivered a few people in front of me now. I don't need to mention much more to convince you of the inequality between north and south of Fraser. Everybody before me mentions that clearly. I would like to explain to you the doctor point of view of trying to convince the leaders. We're not a politician. We do not represent a party, conservative or leader. We represent you. Our main focus is you. We work for you and not for the government. We have been advocating for you for many, many years. You may be told that the problem is new. Actually not. When I started in 2008, the problem was old, and still until now, nothing has changed. In 2008, we were delivering 3,800 a year. Today, we're delivering close to 6,000. How much more beds we gain? 4 beds. Put the number in front of you and you know that the problem has been long-standing without any attention from the leaders. I don't really know whom to blame. I'm not here to blame anyone. I like to tell the people in power who have the authority and the ability to bring this issue to settle because of the safety of our children. Having a baby, as you all know and experience, is the most crucial moment in your life. Our doctors strive hard and work hard to keep updated, to keep knowledgeable, to have more skills, but they need a space to work and additional staff to work. Our nurses, every day we come to work, we are so concerned about the safety. We have reached the minimal safety anybody can tolerate. I travel all over the world to do missionary work, and I can tell you, in very few number of years, will be much worse than third world country in terms of looking after babies. And therefore, time has come for the leader who has the authority to make a change to do it now and not tomorrow. We chronically diverting our patient out of region. The patient follow her doctor with the hope that she deliver in Surrey. Now, unless you are high-risk patient, you are not going to stay in Surrey because of lack of beds, lack of nurses, lack of infrastructure. We have made that clear to the health leader in our province. In 2008, they wanted to turn Surrey into tertiary unit for obstetric, which means starting the NICU unit, which is a great success we achieved. However, since that time, we've been delaying it from 2008 until 2010 to convince the government that we need more beds, more nurses, more infrastructure. I can tell you clearly, today we're not different. The difference is the number I see in front of me. Please apply pressure, speak out. Thank you. It's my pleasure to introduce my colleague, Dr. Brar from the Cancer Agency, who kindly came all the way through to give us some insight.
Thank you, Dr. Bakhet. Friends, family members, my esteemed colleagues on the podium, I stand before you for the same reason that you are standing here today. For an oath that I took as a physician and a promise that I made to the patients that I am going to provide you the best health care that I can provide. And I'm standing here today to tell you that we are failing. As a cancer surgeon, I have to see patients every day and tell them the grim news and the prognosis they're facing. I also have to outline the journey that lies ahead of them. I can tell you right now, as a gynecological oncologist, if a woman in Fraser Health is diagnosed with an ovarian cancer, the soonest you can come and see us is approximately 2 months. The standard of care dictates that she should be seen within 2 weeks. Even after I see you and I book you for surgery, the standard of care is that the surgery should be done within 2 weeks. Our current wait list is approximately 3 months. Cancer does not wait. Women, our mothers, our sisters, our daughters are dying, waiting to get the care that they need and the care that they deserve. Amongst you in the crowd today are some of my patients. I stand here in front of you to support you, to advocate for you, to beg the government to provide us the resources that we need to save the women of British Columbia. I also stand here in support of the family members who have had to take time off from work, who have to cross 2 bridges and wait 10 hours for their appointments, for their blood work, for their CT scans. Family members who have had to forego careers to take care of their sick ones. The other group of patients that I'm standing here for are the ones that cannot be here today to look at me, to listen to these words, and to see this crowd. because those are the patients that died waiting for cancer surgery. They died on the wait list. Beverly McLaughlin was the Chief Justice of Canada. She's the longest serving Chief Justice, and she made a statement: access to wait list is not considered access to healthcare. That statement is more true today than it was on the day those words were spoken. If you need to know a bigger example and a more glaring sign of disparity, Mayor Lachlan, when she started her speech, she said she did not think she would be competing with the SkyTrain. Today, no speaker has gone uninterrupted by that SkyTrain. But remember this, that SkyTrain starts in a health authority where there is one hospital and finishes in a health authority where there are 5 hospitals within a 10-mile radius. If you don't see a bigger glaring example of inequity that exists in Fraser Health, you just need to look to my left and to your right. I thank you all for coming here, and I thank you for all my patients, their family members who came here to support the cause. Thank you.
I'm going to introduce somebody that doesn't really need an introduction. His name is Harjinder Thind. I would like to introduce Mr. Thind as he's been a very strong and vocal voice in our community, a patient advocate, and a person who asks the tough questions to people that make the policies. I would like to invite him to the stage and take us through his experience that's brought us here.
Good afternoon, friends. I want to tell you first that why we are facing this problem. Fraser Health Authority failed to do their job. Fraser Health Authority could not advocate enough to get the fair funding for this region. And that has started a big problem. It's not just that. Fraser Health Authority has started dancing on the tune of the health minister. And that ruined everything. And I want to tell you that we, the people of Surrey and other area of the whole region, we tried our best. We donated, contributed millions of dollars to fix this problem. But we couldn't do it because more money we donated, less money they given. They keep on reducing the funding on and on and on. We reach to this point here where we are out and rallying. Surrey de loko ਘਰ ਘਰ ਦੀ ਕਹਾਣੀ ਹੈ ਇਹ। ਮੇਰੇ ਪਿਤਾ ਜੀ ਨੂੰ ਸਟ੍ਰੋਕ ਹੋ ਗਈ। ਉਹ ਸਰੀ ਮੈਮੋਰੀਅਲ ਹਸਪੀਟਲ 'ਚ ਲੈ ਕੇ ਜਾਂਦੇ ਨੇ। ਜੇ ਇੱਥੇ ਪ੍ਰਬੰਧ ਹੁੰਦਾ ਤਾਂ 4 ਜੁਲਾਈ ਨੂੰ ਉਹਨਾਂ ਦੀ ਮੌਤ ਨਾ ਹੁੰਦੀ। ਅੱਜ ਮੇਰੇ ਪਿਤਾ ਜੀ ਜ਼ਿੰਦਾ ਹੁੰਦੇ। ਜੇ ਕਿਸੇ ਨੂੰ ਹਾਰਟ ਅਟੈਕ ਹੋ ਜਾਂਦਾ ਸਾਨੂੰ ਪੁਲ ਪਾਰ ਦੂਰ ਵੈਂਕੂਵਰ ਲੈ ਕੇ ਜਾਣਾ ਪੈਂਦਾ। ਉਹਨਾਂ ਘੜੀਆਂ 'ਚ ਇੱਕ ਮਿੰਟ ਸਹਾਈ ਹੁੰਦਾ। ਔਰ ਯਕੀਨ ਕਰਨਾ ਜੇ ਵੈਸਟ ਵੈਂਕੂਵਰ ਦੇ ਲੋਕਾਂ ਨੂੰ ਜੇ ਵੈਸਟ ਵੈਂਕੂਵਰ ਦੇ ਕਿਸੇ ਮਰੀਜ਼ ਨੂੰ ਆਪਣੇ ਸਟ੍ਰੋਕ ਦਾ ਇਲਾਜ ਕਰਨ ਲਈ ਐਬਸਫੋਰਡ ਲਿਆਂਦਾ ਜਾਏ ਹੇਠਲੀ ਉੱਤੇ ਆ ਜਾਏਗੀ ਔਰ ਉਹ ਕਦੇ ਬਰਦਾਸ਼ਤ ਨਹੀਂ ਕੀਤਾ ਜਾਏਗਾ। ਪਰ ਇੱਧਰ ਰੋਜ਼ ਹੁੰਦਾ ਕਿ ਚਲਾਵੈਕ ਤੋਂ ਲੈ ਕੇ ਐਬਸਫੋਰਡ ਤੋਂ ਲੈ ਕੇ ਅਸੀਂ ਮਰ ਰਹੇ ਮਰੀਜ਼ ਨੂੰ ਪੁਲੋਂ ਪਾਰ ਕਈ ਪੁਲ ਪਾਰ ਕਰਕੇ ਉੱਥੇ ਲੈ ਕੇ ਜਾ ਰਹੇ ਹੁੰਦੇ ਹਾਂ। ਇਹ ਗੱਲ ਬਿਲਕੁਲ ਦਰੁਸਤ ਹੈ ਗਿਆਨੀ ਜੀ ਦੀ। ਜਦੋਂ ਇੱਕ ਡਾਕਟਰ ਨੇ ਇਹ ਗੱਲ ਦੱਸੀ ਸੀ ਕਿ ਮੈਂ ਇੱਕ ਮਰ ਰਹੇ ਮਰੀਜ਼ ਨੂੰ ਬਚਾ ਰਿਹਾ ਸੀ ਜਦ ਹਾਲਵੇ ਦੇ ਵਿੱਚ ਪਏ ਮਰੀਜ਼ ਦੀਆਂ ਚੀਕਾਂ ਮੇਰੇ ਕੰਨਾਂ 'ਚ ਪੈ ਰਹੀਆਂ ਸੀ। ਜਦ ਮੈਂ ਵਿਹਲਾ ਹੋ ਕੇ ਉਹਦੇ ਕੋਲ ਗਿਆ ਤਾਂ ਉਹ ਮਰ ਚੁੱਕਾ ਸੀ। ਉਹ ਡਾਕਟਰ ਕਹਿੰਦਾ ਮੈਂ ਬਾਥਰੂਮ 'ਚ ਗਿਆ, ਮੈਂ ਰੋਇਆ, ਮੈਂ ਅਥਰੂ ਪੂੰਝ ਕੇ ਮੂੰਹ ਧੋ ਕੇ ਫਿਰ ਆ ਕੇ ਕੰਮ ਤੇ ਲੱਗਿਆ। ਜਿੱਥੇ ਇਹੋ ਜਿਹੇ ਡਾਕਟਰ ਇਹੋ ਜਿਹੀਆਂ ਨਰਸਾਂ ਬਰਨ ਆਊਟ ਹੋ ਚੁੱਕੀਆਂ ਹੋਣ ਸਿਰਫ ਫੰਡਿੰਗ ਦੀ ਵਜ੍ਹਾ ਕਰਕੇ, ਪੈਸੇ ਨਹੀਂ ਹਨ। ਜਦੋਂ ਡਾਕਟਰਾਂ ਨੇ ਝੰਡਾ ਖੜਾ ਕਰ ਦਿੱਤਾ, ਚਿੱਠੀਆਂ ਲਿਖਣ ਲੱਗੇ, ਪਬਲਿਕ ਨੂੰ ਦੱਸਣ ਲੱਗੇ ਫਿਰ ਕੰਨ ਤੇ ਜੂੰ ਸਰਕੀ ਤੇ ਹੈਲਥ ਮਿਨਿਸਟਰ ਇੱਥੇ ਆਏ। ਉਹਨਾਂ ਨੇ ਡਾਕਟਰਾਂ ਨਾਲ ਮੀਟਿੰਗਾਂ ਕੀਤੀਆਂ, ਫਰੇਜ਼ਰ ਹੈਲਥ ਅਥਾਰਟੀ ਦੀ ਜਰਕੀ। ਉਸ ਤੋਂ ਬਾਅਦ ਉਹਨਾਂ ਨੇ ਇੱਕ 30 ਨੁਕਾਤੀ ਪ੍ਰੋਗਰਾਮ ਐਲਾਨ ਕਰ ਦਿੱਤਾ। ਇਹੋ ਜਿਹੇ ਥੋਥੇ ਪ੍ਰੋਗਰਾਮ ਪਹਿਲਾਂ ਕਈ ਐਲਾਨ ਹੋ ਚੁੱਕੇ ਨੇ। ਇਸ ਤਰ੍ਹਾਂ ਦੀਆਂ ਝੂਠੇ ਵਾਅਦਿਆਂ ਦੀਆਂ ਲਿਸਟਾਂ ਅਸੀਂ ਪਹਿਲਾਂ ਕਈ ਦੇਖ ਚੁੱਕੇ ਹਾਂ, ਲੇਕਿਨ ਕੋਈ ਐਕਸ਼ਨ ਨਹੀਂ ਹੋਇਆ। ਅਖੀਰ ਨੂੰ ਆ ਰੈਲੀ ਆਰਗੇਨਾਈਜ਼ ਕੀਤੀ ਗਈ। ਇਸ ਰੈਲੀ ਦੇ ਵਿੱਚ ਬਹੁਤ ਵੱਡੇ ਇਕੱਠ ਹੋਣ ਦੀ ਉਮੀਦ ਸੀ, ਔਰ ਇਹ ਰੈਲੀ ਦੇ ਬਾਰੇ ਉਹਨਾਂ ਨੇ ਗੱਲ ਗੋਲੀ ਨਾ। ਅਖੀਰ ਨੂੰ ਜਦ ਫਰੇਜ਼ਰ ਹੈਲਥ ਅਥਾਰਟੀ ਨੇ ਕਾਨਾਫੂਸੀ ਕੀਤੀ, ਮੰਤਰੀ ਕੱਲ ਅਚਾਨਕ ਇੱਥੇ ਆ ਧਮਕੇ। ਸਰੀ ਮੈਮੋਰੀਅਲ ਹਸਪੀਟਲ ਦੇ ਵਿੱਚ ਉਹਨਾਂ ਨੇ ਪ੍ਰੈਸ ਕਾਨਫਰੰਸ ਕੀਤੀ, ਬਲੇਮ ਗੇਮ ਖੇਡਣ ਲੱਗੇ, ਔਰ ਇਸ ਰੈਲੀ ਨੂੰ ਡਿਲੂਟ ਕਰਨ ਦੇ ਵਿੱਚ ਉਹ ਕਾਮਯਾਬ ਹੋਏ ਜਾਂ ਨਹੀਂ ਇਹ ਤੁਸੀਂ ਖੁਦ ਅੰਦਾਜ਼ਾ ਲਾਓ, ਪਰ ਉਹਨਾਂ ਦੀ ਕੋਸ਼ਿਸ਼ ਇਹੀ ਸੀ। ਲੇਕਿਨ ਹਾਲੇ ਤੱਕ ਕੋਈ ਐਕਸ਼ਨ ਨਹੀਂ ਹੋਇਆ। ਦੇਖੋ, ਇਹ ਜਿਹੜੇ ਧੜੱਲੇਦਾਰ ਡਾਕਟਰਾਂ ਨੇ ਪਬਲਿਕ ਦੇ ਨਾਲ ਰਲ ਕੇ, ਕਮਿਊਨਿਟੀ ਦੇ ਨਾਲ ਰਲ ਕੇ ਇਹ ਸਿਲਸਿਲਾ ਸ਼ੁਰੂ ਕੀਤਾ ਹੈ। ਹੋ ਸਕਦਾ ਫਰੇਜ਼ਰ ਹੈਲਥ ਅਥਾਰਟੀ ਦੇ ਜਿਹੜੇ ਅਫਸਰ ਨੇ ਇਹਨਾਂ ਨੂੰ ਡਰਾਉਣ, ਧਮਕਾਉਣ ਜਾਂ ਫੀਅਰ ਪੈਦਾ ਕਰਨ। ਕਮਿਊਨਿਟੀ ਨੂੰ ਇਹਨਾਂ ਦੇ ਨਾਲ ਖੜਨਾ ਹੋਏਗਾ। ਇਹਨਾਂ ਨਰਸਾਂ ਨੇ, ਇਹਨਾਂ ਡਾਕਟਰਾਂ ਨੇ ਜਿਨ੍ਹਾਂ ਦੇ ਖਿਲਾਫ ਤੁਹਾਨੂੰ ਸ਼ਿਕਾਇਤਾਂ ਸੀ, ਪਰ ਇਹ ਨਹੀਂ ਸੀ ਪਤਾ ਕਿ ਇੱਥੇ ਫੰਡਿੰਗ ਦੀ ਅਨਈਵਨ ਫੰਡਿੰਗ ਹੋਣ ਕਰਕੇ, ਫੰਡਿੰਗ ਦੀ ਕਾਣੀ ਵੰਡ ਹੋਣ ਕਰਕੇ ਜਿੰਨੇ ਪੈਸੇ ਪਰ ਕੈਪੀਟਾ ਇੱਕ ਵਿਅਕਤੀ ਦੇ ਮਗਰ, ਪਾਪੂਲੇਸ਼ਨ ਦੇ ਮਗਰ, ਬਾਕੀ ਜਿਹੜੀਆਂ ਹੈਲਥ ਅਥਾਰਟੀਜ਼ ਨੇ ਕੋਸਟਲ ਵਗੈਰਾ, ਜੇ ਉਹਨਾਂ ਨੂੰ ਮਿਲਦੀਆਂ ਨੇ, ਸਾਨੂੰ ਉਹਨੇ ਨਹੀਂ ਮਿਲ ਰਹੇ। ਰੌਲਾ ਸਿਰਫ ਇੰਨਾ ਹੀ ਆ। ਡਾਕਟਰਾਂ ਨੇ ਸਾਨੂੰ ਇਹ ਗੱਲ ਦੱਸੀ ਆ। ਫਰੇਜ਼ਰ ਹੈਲਥ ਦੇ ਪਹਿਲਾਂ ਜਿਹੜੇ CEO ਰਹੇ, ਤੁਹਾਨੂੰ ਪਤਾ ਉਹਨਾਂ ਦਾ ਕੀ ਹਸ਼ਰ ਰਿਹਾ, ਪਰ ਫਰੇਜ਼ਰ ਹੈਲਥ ਅਥਾਰਟੀ ਦਾ ਇੱਕ ਬੋਰਡ ਹੈ ਫਰੇਜ਼ਰ ਹੈਲਥ ਦਾ। ਉਹ ਬੋਰਡ ਨੇ ਕਦੇ ਸਾਡੇ ਨਾਲ ਹਾਂ ਦਾ ਨਾਰਾ ਵੀ ਨਹੀਂ ਮਾਰਿਆ। ਸਰਕਾਰ ਦੇ ਨੋਮੀਨੇਟ ਕੀਤੇ ਹੋਏ ਵਿਅਕਤੀ ਜਿਹੜੇ ਉਹ 'ਚ ਬੈਠੇ ਆ, ਉਹਨਾਂ ਨੇ ਕੋਈ ਬਾਂਹ ਨਹੀਂ ਫੜੀ ਪਬਲਿਕ ਦੀ, ਨਾ ਹੀ ਇਸ ਸਮੱਸਿਆ ਵੱਲ ਉਹਨਾਂ ਨੇ ਕੋਈ ਧਿਆਨ ਦਿੱਤਾ। ਪਰ ਹੁਣ ਧਿਆਨ ਤੁਹਾਨੂੰ ਖੁਦ ਦੇਣਾ ਹੋਏਗਾ। ਡਾਕਟਰਾਂ, ਨਰਸਾਂ ਨਾਲ ਏਕਤਾ ਪੈਦਾ ਕਰਨੀ ਹੋਏਗੀ। ਅਸੀਂ ਜਿੱਤਾਂਗੇ ਜ਼ਰੂਰ। ਥੈਂਕ ਯੂ।
Hi everyone. Before I say my next bit here, I just want to take a moment to recognize our healthcare team that actually spends the majority of time with our patients, suffers with our patients, cries with our patients, and provides the majority of the care to our patients every single day. And that's our nurses and allied health professionals who are here today. And I just want to take a moment to thank them. And before we continue, I would love for everyone on the sidelines to come to the middle. We want to get a nice photo to show this government how many people are here and how powerful your voice is and why you're here to support healthcare in Surrey. Thank you. I trained as a family physician. Family medicine is the cornerstone of a functional healthcare system. When family medicine specialists in our city lack access to vital imaging and lack access to timely specialty care, it limits their ability to care for their patients. As an emergency room physician now, I see the harm that not having access to these resources or not having a family doctor can do. I am seeing more delayed cancer diagnosis, uncontrolled chronic disease, and elderly patients in Surrey waiting upwards of 12 hours or more in a jam-packed, busy emergency room because they have exhausted all other options and have nowhere else to go. It's heartbreaking, and frankly, it's absolutely unacceptable. It's on that note that I have the pleasure of introducing Camille Currie, whose organization BC Healthcare Matters has given patients a voice and has been a strong advocate for timely access to family practice and family physician care. Please welcome her to the stage.
Thank you very much. Before I start here, I'd actually like to take a moment to also acknowledge that there are many amazing physicians that have come up here today that have spoken to you and that have put this rally together. And I think they deserve a huge round of applause from all of us. So as I share with you over the next couple minutes, what I want you to think about is how many family physicians, how many surgeons, how many specialists, how many nurses, how many allied professionals are here in this crowd today. And yet today we talk about demand. We talk about a shortage of our healthcare professionals. But they have given of their free time today to be here to speak up for you. To speak up because you are not getting the care that you deserve. Do you think you're getting the care you deserve in Surrey? No. I don't either. My name is Camille Currie, and I am the founder and president of BC Healthcare Matters. We are a nonprofit society that is run by volunteers from across BC. Our mission is to advocate for equitable, timely access to the healthcare services that every single resident of BC deserves. We have been described by media as British Columbia's most high-profile patient advocacy group. BC Healthcare Matters and I strongly oppose what is happening in Surrey, and we support rectifying the disastrous Surrey Memorial Hospital situation. Members of your community have died because they didn't have access to life-saving services. In 2021, did you know that 87,000 of your residents had to seek care outside of Surrey? This is not acceptable. An astounding number of you don't have a family doctor, someone that can provide you with longitudinal care. But as others today have mentioned, you didn't get here overnight. This situation has been worsening for years. It has happened through several different political parties leading you. And all while this has been worsening, your elected and appointed officials have watched with what appears to be indifference. Empty promises have been made. Band-aid approaches have been applied, and a lack of accountability has become evident. So I ask you again, are you okay with this? No. Do you demand change? Yes. Everyone deserves access to healthcare services in a timely fashion. Imagine if we all woke up tomorrow to find out that one of our family members or friends would not get life-saving treatment, that they would lose a baby during labor, that they would suffer a stroke with irreparable damage due to treatment delays. Every single day at Surrey Memorial Hospital, nurses, doctors, and patients are traumatized by events like this. Surrey Memorial Hospital is not equipped to care for your community in the way you deserve. Yesterday, our Minister of Health, Minister Dix, made a statement. He stated, the ERs are seeing an unusually high demand, and this may be our new normal. Have you had enough of this? Yes. If Surrey standards become the new normal, there will be colossal loss of life. We know that your community is far below the provincial average for number of patients attached to family doctors. This lack of attachment to a family doctor is a large contributing factor to the overburdening of your hospital. A large proportion of people show up at the ER and wait hours for care that could have been provided in the community if they had access to health care in their community. Others show up and they have Another factor is when patients are not attached to a family doctor or nurse practitioner, they do not have their health monitored. Diseases go undetected and worsen. Injuries develop into permanent disabilities. Silent killers like high blood pressure worsen until they result in an acute event like a stroke or heart attack. Then you and your family are left hoping, wishing that someone will save you. But what if our government and our health authorities invested in your well-being, invested in preventative medicine? The picture would look drastically different. We would have a lower burden on our hospitals, we would have a healthier population, we would have the ability to prevent tragedies. Our economy would benefit, our communities would thrive. BC Healthcare Matters strives to make that vision a reality. To do that, we need to break down the barriers, increase transparency, and hold our governments accountable. We acknowledge that reforming our healthcare system will take some time. However, we do not accept that as an excuse for broken promises or delays. Do you accept that? No. There are many things that could be happening right now to improve patient access to healthcare services and to family physicians. We should be easing the process of foreign-trained medical graduates, yet we continue to hear about barriers. We should allow physicians' assistants to work in BC, yet BC remains the only province not approving them. We should be optimizing and reforming the urgent primary care centres, yet a cone of silence remains around costs, staffing, and attachment data, leaving us all in the dark. Now, some of you may be asking, what has BC Healthcare Matters done so far? Well, as I mentioned earlier, we are a volunteer-based non-for-profit. We are an apolitical group, and we have had quite an impact. We've had a petition tabled in the legislature with over 50,000 signatures. We've held 2 well-attended rallies on the lawns of the legislature. We've been led to believe that our public pressure for a solution to the family practice crisis was a factor in the new payment model for family doctors. We've had several op-eds and letters printed in the papers. We won an award from Doctors of BC in January for extraordinary work on meaningful initiatives that make BC a healthier and safer place to live. We can make things happen together. But although we speak for all patients in British Columbia, our volunteers are mostly based out of Victoria. And because our government only responds to public pressure, like this amazing grouping of people today, it is essential that we expand to include volunteers from all over BC and increase the pressure everywhere, like all of you gathering. We can't do this work without your help. Otherwise, each and every geographical area will have to take on their own battles with limited chances of success. Governments often dismiss these as turf wars. While BC Healthcare Matters turf is the entire population of British Columbia. We need to increase the volume on our collective voice to force government to do what it is supposed to do according to the Canadian Health Act. Provide access to health care for everyone. And don't be mistaken, this is a life or death situation. It is pretty certain that thousands of BC residents die each and every year because of government failure to act. Effective action is needed now. I thank every one of you that is here today for taking the time to be here, because I know your time is precious, and I don't take that for granted. But your life is just as precious. And when you leave here today, you need to remember that. I hope you will support BC Healthcare Matters by signing up to volunteer, become a member, donate, or spread our message, because everyone deserves timely access to healthcare. Thank you very much.
Thank you, Camille. I have a very special guest here today. Her name is Kim Nguyen. She will be speaking about her experience and as a patient, coming to Surrey Memorial initially, then transferring, and it just brings joy to my heart to actually see her here today with us.
Good afternoon, everyone. Before I begin, I would like to extend my appreciation to our amazing team of physicians at Surrey Memorial Hospital for organizing this event, and also the people behind the scene to organize this event so that our voices can be heard. Please extend our appreciation to our amazing team in Surrey Memorial Hospital. My name is Kim Nguyen. I'm a post-stroke aneurysm patient. I had a subarachnoid hemorrhage stroke while at work in 2015. And was sent to Surrey Memorial Hospital. I was then transferred to Royal Columbia Hospital for treatment since Surrey Memorial Hospital didn't have the staff and facilities for emergency neurological services. After my admittance at the RCH, I received endovascular aneurysm coils the next day. This was more than 24 hours from my initial onset symptoms. I stayed at the RCX for 30 days. Afterwards, I spent 1.5 years in rehabilitation at SMH and had access to local communities programs to work on regaining my eyesight, short-term memory, speech, balance, and abilities to swallow. When you suffer from aneurysm, time is up the ascent. If Surrey Memorial Hospital had the neurological team, staff, and facilities to accommodate treatment for patients with my diagnosis, local community members could have quicker access to local treatment. Still, I'm very grateful for the emergency team led by Dr. Randeep Gill. Thank you, Doctor. Who did the initial treatment prior to transferring me to the RCH. I feel very lucky to be alive and able to give my speech today. Even though we love living here in Surrey, my husband and I considering moving to Vancouver because healthcare is lacking in Surrey. That makes me feel like the two-tier healthcare exists between the two cities. We are here today to request the provincial health authorities to consider the neurological health service for the Surrey residents. Thank you.
Since this event is being televised and will reach our colleagues and our fellow residents in Vancouver, I want them for a second to imagine one of their family members requiring specialized stroke or trauma care and having to cross the Lions Gate Bridge to receive that care, and due to inclement weather conditions, only have access to that one bridge. That would be completely unacceptable for any Vancouver resident. However, that was the reality for everybody south of the Fraser last winter when the Port Mann Bridge was closed. Stroke and trauma are the leading causes of death in adults, yet Surrey lacks adequate funding or resources to manage both. For penetrating trauma, you may only have 15 minutes to receive life-saving care, which ideally should be at a hospital fully resourced to manage trauma. Royal Columbian has those resources, Surrey Memorial does not. A patient cannot get from Cloverdale to New Westminster in 15 minutes, but they can get to Surrey Memorial Hospital. We need better resources, staffing, and funding to manage these patients. In addition, Surrey Memorial lacks the ability to manage certain types of strokes, whether it be from a clot or a bleed, and must transfer these patients who receive clot-busting drugs or need specialized stroke intervention to Royal Columbian Hospital, again, across that bridge. Furthermore, if you need a neurosurgeon, you'll face a further issue. We have 5 neurosurgeons providing care to over 2 million people in this health authority. North Vancouver alone has 4. Vancouver has 3 adult trauma centers. Fraser Health has 2. Where is the equity? Anita Huberman, the president of the Surrey Board of Trade, has been a strong and vocal advocate for equity in healthcare, including when it comes to trauma and neurologic care. And it's my pleasure to introduce her to the stage.
Everyone, the Surrey Board of Trade, we are Surrey's city building business organization, responsible for attracting business to the city and supporting business to the city. And I want to ask you, are you concerned and do you agree that healthcare is a city building infrastructure piece? Do you agree? I can't hear you. Do you agree? And do you agree that the 1 million people that are expected to live here in Surrey by 2041, our ability to attract businesses will be compromised if we don't have efficient and effective health care? Do you agree? The jobs are going to go elsewhere. The businesses are going to go elsewhere. You see those words behind you? The future lives here. The future is already here, everyone. Surrey needs to be an opportunity city. We need the infrastructure. We have been ignored for decades, not only in Surrey, but in the South Fraser economic region. That is why in February this year, we started on the journey from an economic perspective on our Surrey Hospital Better Care Needs Report. And for the first time ever, a business organization coalesced with our physician communities, with our healthcare services, to ensure that we are working together to ensure that Surrey is that opportunity city. Do you want Surrey to be an opportunity city? Yeah. Everyone, Surrey, we know, is going to be the largest city in British Columbia very soon. We're the highest feeder city of newcomers, especially with the federal government's immigration targets. This is an opportunity for our economy, but it's only an opportunity if we have a livable city. And I know, and the Surrey Board of Trade knows, that we want a livable city for our businesses, for our workforce, for our economy, and for you as residents. So everyone, do you agree that healthcare is a city building infrastructure? Yes, absolutely. We urge the BC government to really change the paradigm. We want revolutionary change. around healthcare infrastructure investments in Surrey as well as the South Fraser economic region. That is the call to action for the BC government. Thank you so much, ladies and gentlemen.
Thank you, Anita. I guess that's how we're supposed to speak at a rally. That was awesome. Now I have the distinct pleasure to introduce a friend, Harry Baines, our councillor. He's been a long-time resident of Surrey, and like all of us, has experienced healthcare that hasn't been taken care of well in our region. He's had a tragedy in his life recently, and he's here to share his experience. Please welcome Harry to the stage.
Hello everyone, my name is Harry Baines. I am a city councillor here in the city of Surrey, but today I'm not here as a city councillor. I'm here as a dad who helps coach my kids' hockey team at North Surrey Ice Centre. I'm the dad you might see dropping off my kids. I'm probably the person you honked at because I was driving too slow in front of you on 152nd Street. I'm a member of this community just like you. So when I'm speaking today, I'm speaking as a member of this community. I've lived here for most of my adult life. I've lived here for 32 years. And in that time, I've seen firsthand the problems that we have at Surrey Memorial Hospital and all of the hospitals south of the Fraser. Just like you, I have my stories. I've seen the things that I've seen. And I'm going to speak a little bit about those today. In 2005, I had a grandmother. She was elderly. She was in her 90s, but this is a woman who, self-sufficient, went for walks every day, took care of herself, maintained a garden, did everything. One day she had a small fall, and out of an abundance of caution, I took her to the Delta Hospital. While there, they did an x-ray. They said, we think she may have fractured her C1 vertebrae. Now, for those of you who don't know, that's the one way up here. And if that fractures, it's very dangerous. They immediately and rightfully put her in a hard collar. And they said, we're going to rush her to Royal Columbian because there's no hospital south of the Fraser that can take care of your grandmother. So we've got a woman in her 90s who's active, mobile, and able to take care of herself. And they put a hard collar on her, and they actually strapped her to the bed because they were worried that while she slept, she might roll over. They said it would happen in hours, maybe a day. We were there for 10 days before everybody north of the Fraser got the health care that they needed, and then they finally found time for my grandmother. And that's when she went over there. And when she got there, Dr. Gittins, who's a very qualified neurosurgeon, looked at her x-ray for about 40 seconds. And he said, no, it's not a crack, it's just arthritis. He took the collar off and said, go home. She was never the same. She was never able to walk again without a walker. She could never take care of herself. She died a few years later. That fall didn't kill her, but it definitely began the decline. The fact that she couldn't get a neurosurgery consult immediately led to her losing years off of her life. Is that what we deserve south of the Fraser? That day it was my grandmother. Tomorrow it could be yours. Is this what we're going to accept? No. I have another story. November 1st, 2017. I remember that date well. That's my nephew's second birthday. And my dad called me and he said, get home as fast as you can. Your mom's screaming. She's holding her head. Something's gone wrong. Come home. Me and my brother rushed home and immediately called an ambulance. We didn't know what was wrong, but we knew that my mom was in a lot of pain. We called the ambulance at about 6 p.m. and we were taken to Surrey Memorial Hospital. I don't know if it's because our ER is overworked or what's going on. We didn't see a doctor for 8 hours. And the doctor told us, I'm going to run some tests on her. We're going to send her for a CT scan. We need to see what's wrong. 6 in the morning, the doctor came into our room and said, don't be alarmed, but your mom's had a brain hemorrhage. She needs to get to Royal Columbian because south of the Fraser, we just can't help her. So we're going to put her in an ambulance. We're going to send a nurse with you just in case her heart stops. And we're going to make sure she gets the care she needs. Not here, north of the Fraser, but we can't help her here. So if she had stayed at Surrey Memorial Hospital, she probably would have been rushed to an operating room. Immediate surgery. She would have been taken care of within minutes. It took tens of minutes to coordinate the ambulance and the nurse with the life-saving equipment in case her heart stopped. We left Surrey Memorial Hospital, lights and sirens blaring, and we made it about 8 blocks before we got stuck in traffic in morning rush hour. Is this acceptable? No. If it's not acceptable north of the Fraser, it is not acceptable south of the Fraser. Recently, 21 days ago, I lost my dad to cancer right here at Surrey Memorial Hospital. And before he passed, we spent about a month in N51 at SMH. And what I saw some of the most compassionate and caring doctors and nurses that I have ever seen. These doctors and nurses are working in the most trying of circumstances. I saw families huddled together after receiving bad news from a doctor, crying, consoling themselves. Were they in a room? No. They were in a hallway right next to the kitchen. I saw dying patients, terminally ill patients, stationed in beds in hallways. Even in the face of death, there is no dignity in hospitals south of the Fraser. Are we going to accept this? This will never be acceptable. So what do we want? We're not asking for anything that they don't have north of the Fraser. We're looking to have regions south of the Fraser. We need an investment in our healthcare. This is where we're going to see the most growth over the next 10 years. Statistics indicate that over the next 10 years, we may see a 30% increase in the City of Surrey's population. We're already behind. If we don't start today, what are we going to do when our city has 200,000 more people? Today, I'm happy to see so many of you here today. I'm happy to see the community finally sticking up for itself and raising its voice. But isn't it sad that this is what it's come to, where the doctors have to arrange rallies to say, make our healthcare better? Where the community has to come out to raise its voice just to be heard? To me, that's sad. And I hope that the powers that be see what's happened here today. Today is the step one. We will continue to fight, and we will continue to battle whoever we need to battle to make sure that Surrey Memorial Hospital and all hospitals south of the Fraser region have the facilities that are needed. We deserve better, and today, as a united community south of the Fraser region, we demand better. Thank you.
Well, I'm impressed that everybody's still here. This is the closing, okay? So you guys get to go home, think about all the stories that you heard, and we wanted to showcase different walks of life coming together, different experiences, so that it's just not tunnel vision or the things that we want to show you, it's what the community is showing you. And to hear some of these tough experiences, first and foremost, I want to thank all the speakers. I can see how I'm not the speaker, I'm talking about these guys. Clearly we're in a tough spot, and there's a lot of things that we need to get taken care of south of the Fraser. We as a community have endured some tough times, but tomorrow can be brighter. We know what we need, and we will fight for equity. There is a path forward, working together collaboratively to develop a strategic healthcare solutions plan. We hope that our action today inspires people to come forward in this fight of equity and equality and continue to hold the policymakers accountable for their actions. In an event like today, it starts off like an idea, but it takes a whole city to make it happen. So I thank each and every one of you. Your presence will make a difference. Give yourself a round of applause, guys. Come on. Because you're standing there not just for yourself, but the next person. I mean, you're standing there for your family or the next person that's walking through our doors. I also want to thank Dr. Gill and Dr. Amol Lail for their countless efforts standing next to me, taking time away from their families and their loved ones to make this happen. And to my wife, who takes all my crazy ideas and runs with it and makes them a reality. And a very special thank you to our social media superstar, Poonam Judge, who worked countless hours behind the scenes, and there's no way we would have made this happen. And lastly, our friends and volunteers for their time and donation. I'll leave you with this. You know, we can make it better, and we will make it better. You've heard some tough times here, but it will get better. I feel that our action created a reaction yesterday, but we're coming for more.